Thank you very much for attending and welcome everybody. I will talk about sleep disturbances and their role in the prevention of chronic disease. And this is a very good theme now after physical activity. We have to speak about sleep, and that is also very important for health. So after the excellent presentation of Laurent, I will try to explain about why it is important to speak about sleep. Why is it essential to study sleep? Because sleep disturbances decrease quality of life. They are associated with anxiety and depression. In addition, they increase the risk of accidents, diminish concentration, and work productivity. Moreover, sleep disturbances are associated with health risk. Therefore, sleep has a role in preventive medicine as a tool for monitoring health. Now we move on to speak about what is normal sleep. Sleep is a naturally recurring and reversible behavior state characterized by relative immobility, lack of response to environmental stimuli, and lowered consciousness. Sleep architecture consists of two types of sleep: non-rapid eye movement sleep called NREM and rapid eye movement sleep called REM sleep. Non-rapid eye movement sleep, NREM, is a state of deep, usually dreamless sleep that occurs regularly during a sleep cycle with intervening periods of movement, of rapid eye movement sleep. You can see this in the graphic, and non-rapid eye movement sleep, it is in the down part of the graphic, and it's a cycle. And differently, rapid eye movement sleep is a state of sleep characterized by rapid and simultaneous movement of both eyes. Non-rapid eye movement sleep constitutes about 75 to 80% of total time spent in sleep, and rapid eye movement sleep constitutes the remaining 20 to 25%. Then the sleep cycle starts with stage 1, non-rapid eye movement sleep, which is the changeover from wakefulness to sleep. The person is tired, and then there is a moment that this changes to sleep, and sometimes we are not aware of that. During this short period of relatively light sleep, your heartbeat, breathing, and eye movements slow, and your muscles relax with occasional twitches. Your brain waves begin to slow from their daytime wakefulness patterns. Stage 2, non-REM sleep, is a period of light sleep before you enter deeper sleep. Your heartbeat and breathing slow, and muscles relax even further. Your body temperature drops and eye movement stop. Brainwave activity slows but is marked by brief bursts of electrical activity. You spend more of your repeated sleep cycles in stage 2 sleep than in other sleep stages. Stage 3 non-REM sleep is the period of deep sleep that you need to feel refreshed in the morning. It occurs in longer periods during the first half of the night. Your heartbeat and breathing slow to their lowest levels during this period. Your muscles are relaxed, and it may be difficult to awaken you. Brain waves become even slower. So we start to begin to this very deep state of sleep. Then what happened? REM sleep first occurs about 90 minutes after falling asleep. Your eyes start to move rapidly from side to side behind closed eyelids. Mixed frequency brain waves activity becomes closer to that seen in wakefulness. Your breathing becomes faster and irregular, and your heart rate and blood pressure increase to near waking levels. Most of your dreaming occurs during REM sleep, so you dream in this period. Your arm and leg muscles become temporarily paralyzed, which prevents you from acting out your dreams. Because if you are dreaming that you are, how to say, eating, you're not going to, you are totally paralyzed, no matter what is the dream. Memory consolidation most likely requires both non-REM and REM sleep, so it is important both parts of the sleep. A sleep period is also associated with physiological changes such as lowered body temperature, increased melatonin levels, and increase of cortisol. Also, there is a characteristic brain wave for each sleep state. Here, we can see that brain waves change dramatically during the different stage of sleep. For example, when we are awake, we have a brain wave like this, very, very frequent, and with a deep sleep, there is ondulations, and the frequency is slower. Now, we move to speak about abnormal sleep. There are many types of sleep disorders and classified into 6 main groups. Each group represents a list of different conditions. Insomnia includes chronic and short-term insomnia. Sleep-breath disorders includes many conditions in adults and children, such as sleep apnea. Then central disorders of hypersomnolence. These are excessive daytime sleepiness that is not attributable to another sleep disorders and includes all types of narcolepsy. Circadian rhythm disorders consist of sleep-wake disorders, such as from shift work and jet lag disorder. And then we have parasomnias that are sleep disorders that are associated to the sleep cycle, non-REM and REM parasomnia. And finally, sleep-related movement disorders such as bruxism and restless syndrome. Then now I'm going to describe very briefly which kind of sleep disorders are more frequent or interesting. Only some of them. First, insomnia, which is the most frequent, affects many people, and the causes are multiple, such as stress or poor sleep hygiene. Narcolepsy or hypersomnia is rare and can be dangerous if, for example, the person is a driver. It can be very dangerous because the person fall asleep unexpectedly and suddenly, and it can be very hard, dramatic. Sleep apnea is more frequent and is associated to overweight and obesity, and is associated to very important outcomes such as cardiovascular disease. NREM parasomnias are, for example, sleepwalking, somnambulism, night terrors, confusional arousals, and sleep eatings. These sleep disorders have the characteristic that are in the NREM period. It means in the phase of deep sleep. It means it is very difficult to awake the person who is experiencing that, and they do not have memories about this episode. Then we have a very special and particular sleep disorder, which is a REM parasomnia, the REM sleep behavior disorder, which is characterized by physically acting out vivid, often unpleasant dreams. And for an unreasoned cause, muscles that should be totally relaxed, as I explained before, during REM sleep, they are contracted and active. So, for example, a person is dreaming that he's playing tennis, and he's going to do the movements, and maybe he's going to hurt the partner that is sleeping beside him or her. So it's very dangerous for the person and also for the partner. But not only for that, because this sleep disorder is associated with an increased risk of developing Parkinson's. It is more frequent in older people, in men of between 50 and 70 years, and after 10 years, until 80% is going to develop Parkinson. That is a very, it's a situation that makes us to try to detect this disorder. Then we have finally sleep-related movement disorders that are frequent, such as restless leg syndrome and bruxism. Now I'm going to speak about sleep disturbances and chronic diseases. Sleep disturbances are associated with many chronic diseases. Some of the most common associations are, as I said it, the REM sleep behavior disorder, which is associated with the high risk of Parkinson's and dementia. Sleep apnea, which is very frequent, is associated with cardiovascular disease and diabetes. It is also associated with breast and kidney cancer. Also, sleep apnea is frequent among people with chronic pain. Finally, sleep disturbances such as insomnia are associated with depression and anxiety, but also with diabetes and obesity. Now I'm going to speak a little bit about some experience with two sleep disorders that are relevant. Here we are going to speak about diabetes risk. I have worked with the ORISCAP-LUX 2 study, which is a population cohort study in Luxembourg. And here we worked with an evaluation, a very comprehensive evaluation for more than 1,000 people, with sleep questionnaires, physical examination, blood samples to have biomarkers of diabetes, and also objective measures of sleep with accelerometers. And we found that short sleep duration was associated with diabetes risk, but not only with that, but also with insulin sensitivity. Then I would like to speak again about REM sleep behavior disorder, which is unfortunately associated to a high risk of developing Parkinson's. This is why many studies in the world are now focused on how to detect this sleep disorder to prevent the apparition of Parkinson's. And here I'm going to show you what happened. The typical disconnection between the dream content and the muscles in REM sleep behavior does not work. And where is that? This process occurs in an area very close in the brain where the substantia nigra in Parkinson's degenerates. So there is some connection. Maybe it is a prodrome of Parkinson's. We have to see that. Then people that have REM sleep disorders and Parkinson's, they have more frequently dementia. Intending to detect REM sleep behavior disorder and follow up with these people to prevent Parkinson's apparition, the Luxembourg sleep study was created by the NICER PD group, and this study was really successful. I was involved from the beginning, and the study consisted to invite all the residents from age 55 to 75 to answer an online questionnaire about REM sleep disorder, very easy. And we had 16,000 people that answered with valid information. And this was very interesting because after that, the Parkinson group follow a protocol. These people are interviewed, and then they had a Parkinson questionnaire, smell test, and face-to-face evaluations. At the end, to select people that have really idiopathic REM sleep behavior disorder, to follow up them and to give the opportunity these people to participate in randomized control trials to try to prevent Parkinson. This is very nice. So this work was selected to be presented in an international conference. I'm going to present this next week. Now we move on to the sleep assessment methods. This is very interesting because it is linked with Laurent was speaking about objective measures. And what I have to say first is that the preliminary sleep evaluation in primary care is often completed with a sleep questionnaire and sleep diaries. It doesn't mean that people are going to fill out in a paper. Now we do it online with an application. This is much easier and much easier to follow these people. Sleep questionnaires are very inexpensive and rapid tests, and for these reasons, they are ideal for the first diagnostic test. Moreover, they summarize the subjective perception, which is very important, of the patient about his or her own quality of sleep in a quantitative way, because this questionnaire, they have scores, and we can have this data continuously. It's very interesting. Some people, they say, it's subjective. Their subjectivity does not necessarily render questionnaires inaccurate. Then we have objective sleep measures. Other methods to evaluate sleep are objective, of course. The most accurate and reliable method, and considered the gold standard, is polysomnography, which is an exam that is a combination of electroencephalogram, electromyography, electrocardiogram, and all this with videos. It is in the hospital. And then another objective method, which is less accurate than polysomnography, but more accurate than a questionnaire, is in the middle, is actigraphy. Here, I show you a comparison between these two methods. Actigraphy is also adequate because, differently from the polysomnography in the hospital, it is measured in real life conditions. It means at home, every day. We can measure this by every day, by all the year if we want. And all the data are collected in the smartphone. Okay, it's very convenient. In addition, it's much less expensive, which make it suitable for clinics and population studies. Subjective and objective sleep measures give complementary information, and with objective measures we can obtain much more details about sleep patterns. And here, for example, in the graphic, you can see the orange parts with board that is green. These are sleep periods, and sometimes we can observe a peak of the green color. It means the person waked up. Maybe this person went to the bathroom. So we can follow this person with a lot of details. Then emergency sleep technologies, this is amazing, because they have increased and have helped much in terms of lower cost, increasing accuracy in real-life conditions, and involving the patient in his treatment. The patient is not anymore passive, it becomes an actor of his health or her health. So it is much better to make them understand the problem and to make them to cooperate for their own interest. We have, for example, now bed sensors that monitor movement, respiration rate, and heart rate. This is wonderful for detecting sleep apnea, which is very, very relevant, important for health. There are also wireless electroencephalograms installed in the ear, a new technology that through Wi-Fi allows the measurements of a series of sleep variables at home. This is amazing, yes. Then, now we move on to the prevention and treatment of sleep disorders. For prevention, I'm going to sleep after about sleep hygiene measures that are capital, not only for prevention, but also for treatment. And they are important and relevant for you and for me and for all of us, because everybody has to sleep. Then, if the objective is prevention of sleep disturbance, sleep hygiene measures are effective, but the treatment starts almost always with sleep hygiene measures, and the treatment depends on the type of sleep disorders, as is it shown by this flow diagram. For example, if the person has a sleep apnea, maybe this person will require at the end CPAP during the nights, and if this person has a REM sleep disorder, will require pharmacotherapy. So this is the most important part of my speech, I think so, because it is helpful and very practical. So here you have the sleep hygiene measures. The general recommendation is that an individual not go to sleep hungry or eat a heavy meal before bed and minimize liquid intake in the evening. The general rule also is about the sleep environment, is to ensure that it should be cool, dark, quiet, and comfortable. And more recently, free from electronics. It means you go to bed and you have to turn off every light, even the very, very little. You have to turn off all the lights, and you have to put curtains. And also, it should be a little bit cool or cold, but never warm. So the other thing is that you have to stop with the computer and with the smartphone and all the electronics at least 2 hours before going to bed. It is the same for coffee and alcohol. Physical exercise, it helps a lot, but not the 2 hours before sleep. It is better to have a physical activity every day, but not very close to the time to go to bed. The important thing is to go to bed at the same time every day, even the weekends, and to get up every day at the same hour. So for that, maybe we can use an alarm to say, you have to go to bed. And then when the person wakes up and it has a clock, these clocks should be eliminated. It appears that monitoring the clock increases the worry, even for people that do not have a problem with insomnia. So then sleep recommendations vary very much along this lifespan. For example, a child needs about 9 hours of sleep, and an older person 5 to 6 hours. It's totally different. So we don't have a rule for everybody. And now it is the end of my presentation. I am happy to take your questions.
Thank you very much for your presentation. I have a question related to type of sleep disorder that it has to do with the night and day cycle. For example, for some profession and as medical doctors or other that they have night shifts, how can sleeping with doing all of the recommendation that you mentioned in the last of the presentation give sleep quality? For example, when the doctor come back after a night shift and turn all the light off, and does this still compensate the sleep quality, or there is here could be, for example, melatonin or other type of intervention should be done? Thank you.
Yes, very interesting question, because it matters. So there are many professions, not only medical doctors, but nurses and many other people that they have to work on shift. So first, yes, there are a lot of measures that are helpful. Yes, melatonin, you said it. Yes, to turn off the lights, to put everything dark without any noise, it helps. But with all this help, even there is, I show you that the cortisol, it is elevated in the morning, but this is related to light. And it is very difficult to go against the light cycle. So because the stimulus, it goes through the eye, so it is difficult. And these professions, they have more health risk. Yes, they have, for example, problems with insulin resistance, they have more risk for cardiovascular disease. Yes, so it is important to ensure the maximum of sleep habits that are good, and melatonin can help.
Yeah, it's maybe more a comment than a question. You present the recommendations about physical activity and the effect on sleep. And it's true that one of the recommendations is not to do intense physical activity in the evening before going to sleep. Actually, there was a very interesting study published a few years ago which demonstrated that it's not so bad, actually. If I remember well, it was a crossover randomized trial, and they demonstrate that high-intensity interval training actually was not associated with a higher core temperature, or actually the core temperature came back to a basal level quite quickly. The same with respiratory frequency, and the quality of sleep was not impacted by high-intensity physical activity. So it might be a bit controversial topic, actually.
Yes, it's very interesting, Laura. Thank you very much for your comment. I think, yes, I imagine, but because I have to check the literature, that it could be depend on how to say, yes, because sleep is a question also of a routine. And if you do all the time, the same routine, it can work. And maybe if you take a shower after, yes, it can even help. But people that start to do physical activity and they are not in the routine, maybe it is not good. So yes, to sleep well, we should do every night the same thing. So if you do a physical activity, why not? But the same thing, I think so.
Is it beneficial to also practice short period of time sleep during the day, so basically taking a nap?
It depends. It depends. If it is short, it is beneficial, of course, if we are very tired. But more than half an hour, it can. After that, people that have tendency to insomnia, they are not going to sleep, not at all. And if you have a sleep disorder, we don't have to do that. For example, people that have narcolepsy, if they do naps, it is even worse. So it is, or sleep apnea. Yes, I think naps are for people that are very tired and do not have sleep disorders. It can work with a very short nap.
Does the time zones impact our sleep patterns? It's like, is there a simple way to understand your natural sleep pattern versus our adapted sleep patterns? For example, originally I'm from India, so my genetic makeup is based out of different time zone, and I'm living in Luxembourg, and there's a difference of 4.5 hours.
Yes, of course. I already mentioned that there are two types of circadian rhythm disorders. One is jet lag disorder, and the other is the shift work problem. The jet lag disorder is a real problem, and so for people, for example, for pilots, airplane pilots, and for people that work in airplanes, it can be very mostly if they stay. You are going to experience this jet lag more if you stay more than 24 hours in the place. And for avoiding the maximum of this problem of jet lag, it is recommended that you follow the hours of the zone of the country you are arriving. So, but it is it is a problem for people that work on that. So yes.
And the second question is effect of sleep monitors on our sleep do they disrupt our sleep? Because they are constantly monitoring, and definitely there is optical wave stimulation that is happening. So I'm just curious about to know that.
It depends. Is it sleep monitoring or sleep treatment? Because we have, for example, if you use a CPAP for sleep apnea, it makes it makes a sound that it can be not good for the people that sleeps with you, but it is, if it is all only assessment, I don't see why it could be disturbing. Yes, the sleep, because sleep assessment with this Wi-Fi things that if you put how to say something to hide the light, it's okay. So they are not going to make sounds.
And for the wearables, like Smartwatch, which is also emitting light when it is monitoring 24/7 during the sleep.
Yes, here, yes.
Yes.
Yes, it is true that for people that are very sensible, yes, it is better to hide this light, yes. Because, yes, I notice, I monitor my sleep, and then sometimes I see this green light.
Yes.
Yes, but the worst light is the blue light of the computer, and also the blue light of the computer. It makes you that you produce less melatonin, and it's not good.
And I also noticed that during monitoring, there is a constant LED which illuminates and gives signals. So I was thinking that maybe it also disrupts your sleep.
It can disturb the sleep. I think we have to balance what are the benefits and what are the adverse effects of this monitoring. Most of the time, there are more benefits than even adverse of this assessment. Because if a person that starts to sleep better, it's encouraged to maintain hygiene sleep habits.
Yes, makes sense. Thank you.
Sorry, two more. Is the sleeping time as the sleeping pattern individual? Can these be related to some specific genes?
Yes, very interesting question. Yes, of course, there are people that are very energetic in the morning, and other people that are very energetic in the evening. So this is yes, strongly genetic, but also it can be modified with the time. Yes, it is much. The better it is. We are easily wake up. Yes, and as one of the advantages of being aged is that yes, we sleep less, and yes, it is true that there are people that are more comfortable in the evenings, or another more comfortable in the morning. Yes, and the productivity also is different.
Is it then another question linked to that? Maybe is it possible to switch from a morning person to an evening person?
Yes, it is, but not. I think it is almost mandatory, because the school starts at 8 and not at 10. Yes, so with the time, children and adolescents, they start to adjust, and adults to work, because it's like this. But because most of the jobs are during these periods. Yes.